Good morning. Welcome back to the Broadcast Retirement Network. This is BRN AM for Friday, May 10th, 2024. And our top story today, a new technology may provide rapid assessment of heart disease. Joining me now to discuss this and a lot more, Dr. Surahbi Atreja is with UC Davis Health. Dr. Atreja, it's so great to see you. Thanks so much for joining us on the program this morning.
Thank you for having me.
It's great to see you. Let's talk about basics. I want to get into the heart of the study and these developments in a few minutes. But let's talk at a very high level. What is the CAD score system?
So, very good question. CAD score system is actually a small device. This is a small stethoscope-like device. This is AI-based tool, which is simple enough. You keep it on the heart sounds. So it will record the heart sounds for 8 seconds while patient holds the breath. And then it will analyze the coronary blood flow and determine if there is any obstruction in those coronary arteries.
And heart disease seems to be an increasingly rampant disease. It increases its spread across America. This development couldn't come at a better time, especially for those working in the emergency room or those working with potential heart patients.
I agree that as a cardiologist, we know that 1 in 20 adults, like 5% of the patients, do have coronary artery disease. And in any average ER day, about 5% of the patients who show up are of chest pain. So chest pain is a very important complaint with which patients present to either emergency room or primary care offices. And coronary artery disease is number one killer in United States. And also, of all the heart diseases, coronary artery disease or blockage of the arteries is very common.
And how does speaking in lay terms, how does the device work? Does it use, you sit it on top of the individual's heart, I'm assuming. It's not invasive, it's outside the body. How does it detect the blockage, the potential for a blockage?
So it's like a stethoscope-like device if you have to simplify it to the core, right? So you put it on the heart and it will record the heart sounds. And the acoustic signals are way, way higher, so as to speak, sensitivity, to an extent that it can try to hear the sounds produced by the blood flow in the coronary arteries. And as you can imagine, if there is any obstruction or narrowing, the blood flow through that artery produces a specific kind of sound. And that is what this device is attempting to hear. So all the murmurs or the sounds which are produced by flowing through an obstructive lesion, the stethoscope-like device or acoustic signals from the heart are recorded and later analyzed. There is some algorithm. It is an AI-powered device. So they have gone through various to train this stethoscope-like device to train that, okay, if you hear this kind of a sound and this is related to the obstructive coronary artery disease. So there is 2 more things like age and patient's biological sex, which goes into the prediction whether or not there will be obstruction. So it is a combination of patient's risk factor plus what the device is actually hearing.
And how long did it take you and the team, because it always takes a group of people to develop this, how long did it take to develop this? Because you talked about artificial intelligence and training it. And AI has come a long way, clearly, but how long did it take to create this device?
This device already has a CE mark in Europe. In United States, we are using it now. However, it was recently FDA approved. So this device has come to United States recently, and we will be the first site at UC Davis to actually compare it with what we do routinely to assess our coronary artery disease patients or patients who present with chest pain. But actually, it has been in Europe for a while. And there was a study in Europe around like 1,000 to 2,000 patients where they studied results from this acoustic device and compared it with CT scan. So it was already there in Europe, and we are just getting it. So we did not develop this device. We are just trying to see if it works as good as stress test in ruling out, not ruling in, ruling out coronary artery disease. For instance, patients who have low risk factors, who are not going, like who we determine that they don't have heart attack, but they have enough risk factors to develop CAD, so low to intermediate risk patients. They usually go for stress testing in United States.
Yep.
So what we are trying to do is whether this device, CAD score device, can actually perform as good as stress testing.
Yeah. Well, Dr. Atreja, I need to take a very quick break. When we come back, we're going to talk more about this device and what it can mean for heart patients. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network. Dr. Atreja, thank you so much for staying with us this morning.
Absolutely. Thanks for having me.
Yeah, this is, I don't want to say groundbreaking because, but it is in essence groundbreaking. I mean, if this does pan out, that it is as successful in measuring this potential CAD, this obstruction, this could actually be used across the United States and actually help identify future heart risk patients.
Absolutely. Where I see it being used or helpful will be two settings, like emergency rooms. So emergency room, when a patient presents to emergency room, typically either if they're having acute heart attack, they go to the cath lab. Patients who are not having any heart attack kind of symptoms, and we feel that they may have stable coronary artery disease, like a blockage, but not heart attack. So those patients undergo stress test. But the problem with stress test is it's not immediately available. Oftentimes patients wait, 10 to 12 hours to get that test. And in a busy ER setting, as you can imagine, that these patients are sitting there for a long, long time. And then stress testing, depending on what test you use, there is some radiation risk as well. So for the low risk patients, if you use CAD score, it can be done within 10 minutes. and patient can be safely discharged if it comes negative. So the beauty of the test is it comes with a score. So if your score is less than 20, that means it has a negative predictive value in 90s. So 90% chance are you are fine. And then you don't have to wait those 10, 12 hours in emergency room to get this stress test and expose yourself to radiation in some cases, and can be safely discharged. In
And
office settings, it's even, I'm sorry, go ahead.
no, finish your thought. I interrupted you. I apologize.
No worries. In office settings, it's even more difficult because you get pre-authorization, and oftentimes patient waits for weeks being anxious, like, okay, do I have heart disease or not? Do I go around with my life or not, right? So this could be a quick tool in low to intermediate risk patients where you can further get the results in low risk patients, that if they do not have high score, then they are safe to be discharged and they do not have to stress about this, that do I have blockage till till my stress test gets scheduled, which could be few weeks in outpatient setting. So I think it's a quick triage tool that that, okay, these patients are low risk and they can be safely discharged, and it takes a stress away from physician and the patients.
And you're collecting the data. One of the benefits of artificial intelligence is to look at data sets and to identify very quick trends. All that data that you're going to be collecting, I would assume, would help create some type of predictability or profile of individuals that are more subjected to this risk.
Absolutely. So we will get wiser as the study will go by, that we are anticipating at least 200 patients who we will compare with traditional stress tests. So patients who we have already identified that they will be assessed with stress test, those patients, we will do this CAD score test. And as the time passes by and depending on the trend, we will know that how accurate it is and whether or not, and what is the time save and what are the resources which are saved. And I agree with your point, that is we will have the AI trained even further as the time passes by.
And last question, I mean, this is good information, but at the end of the day, we still have to take the right steps as individuals to eliminate the risk. And is it still diet? You skip down the brass tacks. I mean, I know we're talking about this powerful device, but in terms of maintaining proper heart health, is it still diet, exercise, and good genes?
I cannot agree with you more that coronary artery disease remains number one killer in the United States. It is way more than all cancers combined. So every step we can take to prevent coronary artery disease, which starts with things we can change and things we cannot change. So identifying your genetic risk. If you have a family history, you're more prone, right? So identify, embrace it, and then take steps to prevent be in that position where your relatives or brothers or sisters were. So with good diet, good exercise, following up with your doctors, and if you have already established risk factors like high blood pressure or diabetes, then controlling them is a way to prevent coronary artery disease.
Yeah, I mean, these are amazing tools, and I don't want to take anything away from that, and we should use them. But again, we have a little bit of control. Some things you can't control as an individual, but there are some things you can control. Dr. Atreja, great work. Looking forward to hearing the results of this work that you're doing with the device and comparing it in parallel. And we look forward to having you back on the program again very soon.
Thank you so much for having me and spreading this awareness about coronary artery disease and the simple ways how we can detect it in office settings and ER settings.
And that wraps up this episode of BRN AM. Have a topic of interest, someone you think we should talk to, then drop us a line. And don't forget, for all the latest curated news in lifestyle, wellness, finance, tech, so much more. And guess what? All in one place. Check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content? Well, visit our website. We're back again tomorrow with another edition of BRN Weekly. Christina Hooper of Invesco will be here subbing for Jane King. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes. Now is your opportunity to co-create content around any topic on the first lifestyle and wellness network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.